Ready when you are.
Good to go. I was diagnosed with breast cancer in February 2011. During the operation to actually remove the cancer, several lymph nodes were also found to be cancerous. The scarring of that, both taking out of the lymph and taking the cancerous tumour away, left a dent in the left breast, the nipple veering off to the left, and a quite sizable edema on the underside and the underarm around the left breast. So following all the treatment for that, which has been fairly arduous and it's gone on over a few years, I've had further surgery since then. However, this year I've been on my medication for roughly half of the length of time, which is the 5 years, and my consultant agreed or even suggested that I could look towards some post-operative surgery to correct the very ugly and asymmetric results that I'd been left with. He recommended a consultation with Mrs. Pilar Mate, who I've been to, and I've subsequently had 2 lipomodelling experiences. The first procedure, it was explained to me that the fat was taken from me, which sounded good to me anyway, and that was able to be harvested and a significant amount of it kept due to the fact that we didn't know my reabsorption rate. The first operation that I had, where the fat was taken away, I had full anaesthetic, which was necessary because it's quite a physical, quite an aggressive removal of the fat, and it does leave some bruising, but that was the only side effect. I was put straight away into some gym gear straight after post-operation, which meant that everything was kept very firm and very tight and I didn't have pain, merely bruising. We left that for a week to make sure that everything was okay. And then I was given a couple of months for that to settle down before we decided how much of the fat had been absorbed back into my body. I went back in for a second procedure to then top up those bits with the stored fat, which was a lot less bruising. There was very little side effect too. And obviously it was able to give me back the shape and the symmetrical side of each breast to a great extent as I was prior to my actual first operation, which was fantastic. The thing that it did for me most of all was to give me a far better self-body image, because I was damaged by that mentally. When you look in the mirror and you're very asymmetrical, when nothing feels right, when a bra size is a different actual cup size one to the other, that has a psychological effect. That brings you down, when really I was so grateful to get through it in the first place that what I actually wanted was to just get my body back, feel good when I looked in the mirror, because health-wise I felt well. So for me, although it was a cosmetic procedure, it was the last jigsaw piece in my puzzle to get everything back in my life. And it's certainly a method that I would recommend to anyone left with damaging effects from cancer treatment or cancer operations, because it's something that I would do again.
And did you feel that the Regeneris storage service, it facilitated that? It sort of gave you the push to have it done, because you didn't have to go through the full procedure each time?
Yes, absolutely, because the whole point of it is, had I got to go through that fat transfer every time, that's quite a traumatic, quite an aggressive, invasive procedure. It has to be, because they're taking the fat from you in different places. With having the fact that it could be stored meant that the second part of that operation, seen as the whole treatment plan, the second part was far less invasive, because it was merely putting some in. I think it took about 20 minutes as opposed to the hour and a half for the first op. So certainly I wouldn't be going for it again unless I'd been able to do that 2-part protocol, which enabled me to not have hardly any side effects the second time.
That's great. Thank you very much.
Okay, no problem.